Let's wait for another 5 minutes and then we'll start. Is that okay? Dr. Anupama Difana. Good afternoon, everyone. Thank you for joining today's webinar on Smarter Public Health with Informatics, where we're going to talk about systems, strategy, and what skills are required in the field. So we'll start with the webinar. Over to you, Dr. Priksha.
Yeah, thank you, Shireen. And yes, welcome to all of you for today webinar. And I will request Shireen to share the slides, please. Mhm.
Is the slide visible?
Yeah, it's visible, Shireen. Uh, we can start the slideshow. Yeah, please. Thank you. So again, good afternoon to all of you who have joined this webinar, and thank you so much for taking your time out and join this webinar. As Shirin stated that the webinar is on the smarter public health with informatics, system strategy and skills. Next slide, Shirin. So I'm Dr. Preksha Singh, working as a consultant at HISP India, and I'm joined by Dr. Shireen Saini, Senior Advisor Capacity Building at HISP India. And today in this webinar, we are going to discuss how public health informatics and system thinking are crucial for evolving public health practices, especially in today rapidly changing digital landscape. So next slide, please. So before moving further, let me briefly introduce the HISP India at which we are working. And so HISP India is committed to strengthening public health system and communities through digital health innovation. At the core of HISP India, it is committed to sovereignty, reciprocity, mutuality, and collaboration. And some of its key achievement is that HISP India has co-created open source digital solutions, open source platforms, and digital solutions like DHIS2 and OpenMRS that are tailored to the local context. Also, HISP India believes that technology is there to empower users and communities and not to control them. So, next slide, please. So, let me walk you through the agenda. So, here are the topics that will be covered today. The first, we will discuss that why we need to rethink public health, especially in the digital age. And then we will delve into what is public health informatics and why it matters now. Then we will also explore system thinking. That will be a slightly new concept for some of you. And but the system thinking is a powerful lens for understanding public health challenges holistically. Therefore, we will discuss about system thinking. Finally, we will also learn about some interoperability and open platform in public health informatics. Next slide, please. So let me begin this webinar by conducting a small poll. So the question of this poll is that what do you think are some of the emerging public health challenges today? So you can type your answers in the chat box and we can discuss it more. The question is that what are some of the emerging public health challenges? So it will be very nice of you and so that you can type your answer in the chat box. Whatever you feel that these are some of the emerging public health challenges because there are n numbers of emerging public health challenges right now, especially in the context of LMICs. So we can wait for 10 to 15 seconds so that you can write your answer in the chat box. Okay, so never mind. And so currently, we all knew that some of the emerging public health challenges today are pandemic. And yeah, Dr. Surya is right that maintaining all the reports with the patient, definitely. This is one of the emerging public health challenge. And beside this, there are also public health challenges like pandemic of COVID-19, which we have already surpassed. and the increasing rise of the antimicrobial resistance, and also the increasing burden of the NCDs. So these are some of the emerging public health challenges, and there are many more beyond this. So, but when we talk about, and the research has also shown us that at the root level, all these public health challenges are complex and often interconnected. So let us discuss these issues in detail, and some other things related to this. So public health today stand at a crossroad because we are grappling with challenges that are no longer linear or isolated. They are complex, fast evolving, and interconnected. For example, we have discussed yes, Mpox in Ghana, definitely. Yeah. If we talk about countries outside India, then Mpox in Ghana is there, and there is high probability that if because we are living in a global world, that disease in one country cannot be limited to that country, and there are high chances that it can be transmitted to other countries. So that is why if there is a disease in one country, so each and every country is equally at a same risk for that particular disease. So any disease can't be taken lightly. So, as discussed here, we are witnessing the rise of complex health emergencies from pandemic like COVID-19, again, the increased threat of AMR and the burden of NCDs. And like in the chat box, we have seen that Mpox in Ghana and maintaining all reports with the patients. So these issues are multidimensional, if we can see that, and they cross health, environment, and social boundaries, and they cannot be solved with isolated interventions. Secondly, we are still operating in a fragmented, separated data system. For example, if there is a TB and HIV program that collect data separately. So even if one patient has both the disease, like he or her has both HIV and TB, then his or her data is entered into the system separately, and these systems don't talk to each other. So ultimately, this result in the duplication, inefficiencies, and also the missed opportunity for integrated care. And thirdly, we have there has been in tremendous digital transformation also, and many tools are used in isolation. For example, these are dashboards that were created during the COVID-19 pandemic, and now there are AI tools for outbreak predictions. But the thing is that these need to be embedded in daily public health workflow. So, and finally, there is a gap in the skill set and the mindset of the human resources currently available. For example, if we give data to the health officer, but if they don't know how to use it, like to visualize trends or filter by risk factor, then the data will just sit idle. So it's high urgency that the digital transformation must go hand in hand with the capacity building. We need professionals who understand how to interpret data, design systems, and apply them in the field. Therefore, it's high time that we must rethink the structure and delivery of public health to include digital tools, data intelligence, and adaptive systems. This is why public health informatics is essential, because it not just as a tech solution, but as a strategic enabler. So in the upcoming slide, we will discuss that what is public health informatics, and how it is an emerging multidisciplinary field. Next slide, Shireen. So, what exactly is public health informatics? Public health informatics is the application of informatics to the area of public health, like in the field of surveillance, preventions, and health promotion. And it goes just beyond data collection, because it's also about designing system that ask the right questions. We are some of us all are already aware of this 5W and 1H concept, that for every situation we should ask this 5W and 1H, like why, what, who, when, where, and how. And the PHI also deals with designing the systems, that designing these systems, maintaining them, deploying them, and continuously refining them, and also evaluating them at regular interval, and for the better impact, because this regular interval evaluation is very much necessary, so that we can have a sustainable impact. And that is where if we talk about public health informatics, is where technology meets public health, and its main objective is to drive smarter decision making. Next slide, please. So, as I told before, that public health informatics is an emerging multidisciplinary field, and it is not just a technical skill. At its core, PHI lies at the intersection of several domains. You can see also in the diagram in the picture given in the slide that there are multiple domains through which the public health informatics is connected. For example, we have a public health practice domain that deal with understanding disease, population, social determinant of health. Then we have this information science domain that deal with managing data flow, storage, and security. Beside this, we have a computer science and IT domain, which build platforms and tools like dashboard, apps, and data system. Similarly, we have a domain like policy and governance, which ensures systems are aligned with health priorities, data ethics, and regulation. So if overall we can see that the PHI combined the best of the multiple world to support smarter, faster, and more coordinated health responses. For example, we can take an example that if there is a disease outbreak, then it need more than a lab test because it need data collection, real-time analysis dashboards, alerts, and logistic coordination, and finally some policy action. And the beauty is that the PHI bring all these domains together under one umbrella. So if we talk about some LMICs like especially India or other country, then PHI really has the potential to bridge critical gap in service deliveries, health equity, and emergency responses. Next slide, Shireen. So, why we are talking about public health informatics in this webinar and why it's matter today? Because the fact is that PHI is more than just digitizing health record. Most of the people connect it with the just digitizing health record. So here we want to talk that it's more than that because it's about using data smartly to guide real-time decisions. It also integrate health sciences, data systems, and public policy to enable better service delivery. If whether it's tracking a disease outbreak or planning where to send vaccines, PHI provide the backbone for timely evidence-based actions. And we can think about an automated reporting of the maternal health indicators. Most of the country has some sort of system which it got the maternal health indicator automatically. And here in this system, the data flow directly from the ground and thus allowing district or state official to act without delay. In India, we have an Anmol app. Some of you must be familiar with it, and which guide ANM, that is auxiliary nurse midwife, a frontline worker in Indian context. So this Anmol app guide ANM in decision making with respect to registering pregnant women, tracking antenatal care visits, and planning deliveries, and also in administering immunization. And while operating the app, the ANM gets some questions which consciously or subconsciously guide her in making some decisions, rightful decisions. Like this app might ask that should the patient be referred? Does she need ANC checkup? Or has a child missed immunization? And beside this, Anmol app also offers some alert, checklist, ready-made checklist, and task reminders based on maternal and child health indicators. So by chance, if frontline worker missed anything, then there's a reminder from the Anmol app so that the ANM could do her work diligently and efficiently. So then there is also an e-Sanjeevani app in India, which is a telemedicine platform, which has built-in triage tools and symptom-based decision tree to guide doctors and CHOs during remote consultation. So here I'm talking about Anmol and eSanjeevani app, and if there is any other app which you would like to discuss or talk about, then we can take it at the end of the webinar, at the end of the question round, because we also would like to know more about such apps which are available in India or outside India. So frontline worker can also assist patient in navigating consultations and referral decisions through eSanjeevani. And therefore, we can conclude that public health informatics is no longer optional, as it makes public health responsive and efficient. It equips us with the tools to be proactive and not just reactive. And we need these digital capabilities to meet today complex health need. But here is a catch here, because to truly transform public health, data is not enough. We also need a new way of seeing problems, and this is where the system thinking comes in. So to know more about the topic of system thinking, which might be new for some people here, and its importance, the importance of system thinking, and how it is linked to public health informatics, I would now request Shireen to take this webinar forward. Shireen.
Yeah, thank you so much, Preksha. So, before I move forward on the systems thinking aspect, I would like to know what are the different applications that might be used or that are in function, in your respective area where you're working. Anyone, if you could share some, public health informatics applications or some tools or systems that you're using for which program? Anyone? Okay, so now I will pick names. So we have Dr. Aditi, Dr. Anupama. I would like to know where you guys are working and have you come across any such application?
Shireen. Hello, Shireen.
Yeah.
Actually, there are some responses regarding the systems in the chat box.
Yeah, I'm just checking. So Dr. Surya says he's working on Epic AMR. Okay, that's great. Then we have Mr. Enoch Sormas for disease surveillance. Can you please elaborate more on this particular aspect, if possible? What's the full form of this particular application?
Yeah, hello.
Yeah.
Okay, thank you very much. And good morning, good afternoon, because I'm currently in Ghana.
Okay, great.
Yes, so it's around 6:52 a.m. here. Okay. So the SOMAS is a surveillance app used by the Ghana Health Service to track disease occurrence. And the full name is Surveillance Outbreak Response Management and Analysis System. And this app is a live app where any data entered is seen at the national level just by clicking the submit button. So it doesn't wait for a downtime before it loads. So once you enter the data for a certain case that you've encountered, it could be seen at the national level for immediate action to be taken. So that's what I would say about it. If there are any clarification, I will also want to add.
Okay, that's amazing. That's great. So for which diseases is it focusing? Communicable diseases, or it's like specific communicable diseases that it focuses on?
Sure. Okay. So it's for all communicable diseases,
Okay.
but mostly we are looking at the ones that are of public health importance. So, for instance, dengue fever,
Yeah.
COVID-19, mpox, and cholera, and all other reportable communicable diseases that are of public health importance.
Okay, that's great. So like it's almost similar to what we have here in India. Like we focus on and it's very specific region. So in the northern part of India, it's more of dengue fever, chikungunya that we focus on. In the northeastern side, it's more of malaria. States like Orissa, which are like in the southern region, again malaria is more prominent. So region specific, we do have these disease surveillance portals with where it's outbreak management and pandemic management happens. So yeah, thank you so much for sharing that.
Okay. You're welcome.
Yeah. Okay, so moving forward, we will now discuss the systems thinking aspect. Anyone has any idea of what is a system? What do you mean by a system? Anyone would like to share? You can drop in your answers in the chat box if you're not able to, speak up, maybe because of the workplace. Okay, so let me continue then. So system is basically this, let's understand with what is a system. This word system is used, it's derived from the Greek term synasthene, which basically means cause to stand together. And if you look at the meaning closely, it basically helps you to understand that system is something which comprises of different components which come together to create a common meaning. For example, having a balanced diet, right? Or any kind of a body system we take, whether it is our circulatory system, nervous system, any system you take, it will always have different smaller components that come together, which are interconnected, and then they form a bigger whole or a bigger system. So this is a very, very basic definition of system that you see on the screen, which is a system is a set of components that are interconnected through processes of input, throughput, output, and feedback. And we also sometimes call it as input, processes, output, and feedback, right? So it the here the emphasis needs to be done on interconnections, which is very, very important. So you might have different components, different parts, but if they are not interconnected, it doesn't form a complete system. So very simply, we basically look at these components, and any system you take, you can always break it down into these smaller components. For example, if you look at a balanced diet, in a balanced diet, we need to have some portion of carbohydrates. There has to be some portion of proteins, some portion of fats, right? And then micronutrients also needs to be taken into consideration. So that's where these smaller components, how are they built up, and what portion of these components create a balanced diet is something that we always focus on. Similarly, when we are talking about a health system will have a lot of these smaller components, right? If you guys have heard about the WHO health systems framework, which focuses on 6 building blocks, right? So these 6 building blocks, which are around, say, technology, human resource, then financing, then what are the prevalence of the disease, or the mortality or the morbidity, the health status, basically. So there are another these 6 building blocks. These are interconnected with each other. If you don't have human resource, it is very difficult to run a health system, right? So that's where system focuses on that. The whole idea is to have these small components which are interconnected with one another so that they form a bigger picture. So keeping this understanding of systems thinking, it basically helps us to understand, or it has the ability of recognizing, understanding, synthesizing the interactions and the interdependencies that are there in a set of components which are designed for a specific purpose, right? So these when we again, this is a very, very formal definition that we have, and it also includes the ability to recognize patterns and repetitions in any kind of interactions that we are seeing. So it basically implies that this approach always helps one to identify what are the different elements of a system as a whole, how these elements are connected to each other, so that we can always rely on implicit models and we can identify the hidden assumptions. There is no clear link to data, and systems thinking will always help you to deploy explicit models. It will help you to identify assumptions. It will help in laying down data or studies that can be repeated by others. So if we bring systems thinking, in our day-to-day work pattern that we do, it basically helps us to understand and look at the health challenges holistically. Also, another thing that we need to understand here is that a system is not real. Okay, you cannot, whatever you are working on, say for example in a research, when you're working on any kind of a research project, so what is the idea of your research, what is the study area of the research, that is what is system. So system for me might be different, uh, and system for you would be different, right? So there is nothing real that okay, this is what we are talking about system. No, it's basically the area that we are working on, that we define our system from our lens, right? So it means that we are able to conceptualize our phenomena. University, if you look at a university, it's not an actual system, but it is, but thinking of it as a system, it helps us to understand what are the different components that you would need to run a university, right? So it is always, it basically provides us with something which is normative and how a phenomena should function, and it is very different for each one of us, right? So here examples you can take as connecting sanitation, nutrition, and diarrheal diseases. So, or in today's time, if you look at the emerging public health challenges, then we have the, say, climate and health. It's a very complex issue. Not one aspect of it. If you just focus, say, on air pollution, it that will not just solve the health status of the population, but we also have to look at from what are the various causes of air pollution, right? How is it leading to, say, any other environmental aspect, or any other environmental pollution that can be mitigated? From which industry are we generating this pollution, right? So we have to basically look at different aspects within this one domain of climate and health, and then try to solve it, from a, again, identify these smaller components in, identify the interconnections, and then make a big, define your system, create that big picture and focus on that. So that's where systems thinking approach basically helps us to, identify what is the study area, or what is the area that we would like to focus on, and then work on that, so that we can basically, from the holistic angle, we can address that challenge. Yeah. Any questions, or anyone would like to discuss anything over here from the systems thinking perspective? Have you applied this concept at your workplace? Anyone? Okay, have you heard of systems thinking before? Yes or no? Just yes or no in the chat box, please. Okay, great. And have you now applied it? Have you applied it, uh, while, solving your issues? Okay, so can anyone whosoever has, said yes, most of you have said yes. So Dr. Surya, I would like to understand from your perspective, how have you applied systems thinking, and in which area have you applied this concept?
I heard about it and I know about it, but I didn't apply it actually.
Okay, okay. Anyone who's, applied it? No one?
Okay, I don't know. I've heard about it, but then I don't know if what I did was applying it or something like that, because in one particular district we realized that the number of mothers having low HB,
Okay.
the number of mothers that were having low HB at 36 weeks of gestation was becoming high. So we went to that sub district, and then we tried to find out why that is happening there. And based on our inquiries, we realized that most of the mothers had poor nutrition. So it was like they weren't taking in the right nutrients whilst pregnant. So throughout, we initiated a health education and then counseling sessions with some nutrition officers to help tackle that. And then by so doing, we realized there were some improvements, though it was marginal, but we could realize there was some improvement. So I don't know if that will be classified as systems thinking, or I don't know.
Okay. So I would like to, further break it down for you. So when you say that the nutrition, poor nutrition was the reason of low HP for mothers in the 36 weeks of gestation, you could have,
Yes.
I would have approached it as identifying, okay, what are the various causes of a poor nutrition? Is it because of, because of the income status of the family, or is it because the nutrition is not available to them, or is it because they are not aware of what they should eat, right? So, is there lack of awareness? Is there lack of, income, or maybe there is a lack of support that they don't get from the family to have a proper nutrition? So, I mean, if you break down the issue of poor nutrition, then you could get multiple causes, right? So that becomes, your system would be addressing, say, low HB count, and of that, the one component is poor nutrition, and within then you identify what are the different causes of poor nutrition and then focus on, right? So like when you said that you promoted health education, that would focus more on increasing the awareness of what kind of food or what kind of nutrition the mothers have to take while they are in their pregnant, while they're in their pregnant phase, right? So
Okay.
that would not address in terms of what kind of support they would need from the family. I hope it's making sense.
Yes, it is.
Yeah, so that ways I think systems thinking would help you to go deeper down of the issue and identify the actual root causes which are there, and then address those root causes. Yeah.
Okay.
Okay, great, thank you so much. Okay, so moving
So,
ahead. Yeah. So we say that systems thinking is a new lens for public health. This basically, if you look at this slide, it helps you to introduce the concept of systems thinking as a powerful lens through which we can better understand and act upon the public health challenges, right? So traditionally, the health programs that we have in any LMIC you take, we have been most of these health programs are designed in silos, which separate, these different aspects. So if I am looking at, say, maternal health, I'm just focusing on maternal health. But how is immunization important in maternal health? How is like if we just focus on, say, antimicrobial resistance, but then how is this going to impact maternal health or any other disease that requires antibiotics, right? So we separate these different programs, and these programs, they work in silos. But in the real world, if you look at, these are not different. These programs will not work. Any disease just doesn't work differently. It is always interconnected. So these systems need to be interconnected and they need to be focused from this complexity and identified that what can be done better. Again, for example, say a child's risk of infectious disease is not just about vaccination, but it is also influenced by nutrition. It is also influenced by the water and sanitation aspect, right? So systems thinking will help us to understand these different aspects and then give us a big picture. So it helps us to understand how the information flow happens between between the communities, between the providers, policymakers, and how we can strengthen that flow. So if you look at here, systems thinking helps you to address the root causes, identify feedback loops, and also helps you to identify leverage points. So say when I say poor nutrition, let's take that example, and within that poor nutrition you get around 5 to 6 root causes. So those 5 to 6 root causes, then you identify, are they interconnected? Is my one, if I design one intervention, how many of these root causes can I address, right? And you identify these feedback loops, and from those you also identify that what are the leverage points. Okay, which are these root causes that can be addressed first, right? Which are easy for me to address, and easy, but at the same time, it is going to have a good impact. It is going to have a much better improvement in the nutrition status for the mothers, right? So those systems thinking helps you to identify all these aspects, and then we can always apply this at a across multiple domains, multiple programs, help in identifying what are the components and how the interconnections are built. Similarly, it then also helps you to understand how am I going to design sustainable intervention. So like I said, can I design one intervention or at the max two interventions, which helps me to address all of these root causes? So it's very um, interesting to understand that systems thinking not just helps you to identify the root cause of the problem at hand, but also helps you in designing interventions which are sustainable and scalable at the same time, all keeping the local context in consideration. And then finally, this way basically it helps you to understand that health needs to be looked at as interconnected. Any kind of a health program or a health system, we have to look at from the lens of an interconnected complex system and not just a silo system sitting at one place and then addressing only just that one issue, right? So that's where the systems thinking aspect comes into picture. So it helps you to understand that the health problems, they are not isolated, but they are deeply interconnected. They are it helps you to understand these connections. It helps us see that the health system as a whole, right? Like I said, so different components, understanding their interconnections makes it helps you to look at a bigger picture. So whether, say, when you're trying to identify linkages between different sectors like sanitation, nutrition, health outcomes, right? All of these things come together. Similarly, in the space of climate and health, we have environmental science. We need health people to address. We need climate informatics or climate experts to help us address this issue. So it's not just one aspect. And within the health sector also, it's like, I'm sure you guys must have now heard about One Health approach, wherein we are talking about animal health and environmental health and human health, everything coming together, how and that needs to be addressed, right? So that's where we are building onto these complexities as we move forward in the field. So the public health informatics basically helps you to enable action on these aspects, on these insights. When we integrate systems thinking and public health informatics, it basically helps us to make data informed decisions that helps us to understand the root causes and design interventions appropriately. So we need to just understand that public health informatics helps us in enabling the action with the help of a systems thinking approach, right? So PHI becomes the nervous system of any kind of a health delivery, and systems thinking becomes the brain. For example, when you build tools like integrated dashboards that helps us in tracking human resource or logistics or any kind of service delivery, everything together in just one dashboard, it helps us to make decisions better. Okay, where are we lacking? How we can improve? Which is the area sector or which particular district we need to focus on? So when you have all of these things together, it basically helps you to understand. Similarly, like for example, Hispindia, the last, I think, 4-5 years, we have been working in the space of antimicrobial resistance. So initially, people were not aware that there is an issue of antimicrobial resistance. They were not aware in terms of like the medical colleges that we are working with. They knew what is antimicrobial resistance, but how to make that information visible was something that they were struggling. And that is where systems thinking and public health informatics, tools like DHIS2 help them to understand, to visualize that information at least. So they started identifying the resistance patterns that they have in different departments of that particular hospital. And then basis on that the resistance pattern that was being identified, they were able to treat their patients much better, because then the correct antibiotic was prescribed to the patients. So that's where these dashboards or system or public health informatics tools helps us in at least making the information visible, and then taking action. Yeah. So these are some of the interoperability and open platforms that are used in public health informatics at HISP India. So we focus on data standards like HL7 FHIR, which is again a API based standard, and the most commonly used standard now. SNOMED CT for the dictionary or the vocabulary standard. DICOM for imaging, transferring the medical images. So these are the standards that we use, and the digital public goods that are used at HISP India. One is the DHIS2, which is District Health Information System. And then we have OpenMRS, which is the open source medical record system. So these applications basically helps us. They can be applied in any of these areas, like if you want to use it for a real-time program monitoring, which is like an outbreak management or disease surveillance, for supply chain visibility, resource allocation, outbreak response, health promotion, policy making, and improved decision making. So that's where these applications have been used so far in the span of 25 years now in the industry. I think we have is Lutfullah is still here in the, I think he left. Okay. So yeah, anyone of you have heard about DHIS2 in Ghana? Is it used?
Yes.
Yeah. Okay. So great. So moving on now, this was just a gist of what we have been talking about, the systems thinking approach and how do we apply it, what tools are we going to use it. If you're trying to understand how you can build your capacity in the field of public health informatics, and that's where we basically help at HISP India. So we have very recently designed this course, which is Fundamentals of Public Health Informatics, along with collaborating with University of Oslo, Norway. This course basically highlights that you'll have mentors from experts in the field, since, like I said, HISP India has been working in the field for almost like 25 years now, and we have worked with various ministries of health both in India and globally in the LMIC context. So we have a lot of assignments which are from the real world case scenarios that we have built. And the whole course is a blended learning, so it's completely online, completely offline also. It is available if you want, and in a hybrid mode also, wherein some sessions can be taken online, some sessions can be taken in person. So it is a very practice oriented learning that you will have in the program. It's not just theoretical. You do have a lot of practical exercises also, where we also have exercises around DHIS2 in terms of, say, for example, data quality when we are talking about, or when we are talking about data contextualization. So those are certain aspects that we basically build on to. These are the topics that we basically focus on: data standards, data quality. But before that, we start with very basic in terms of what is public health informatics, how do we use systems thinking, what is a systems thinking approach, how do we apply it in the space of public health informatics, what are the novel design and development methodologies that go into building a health information system or any system, whether it is electronic medical record. Then we focus on data, like how data needs to be collected, what are the data quality aspects that needs to be focused on, data standards that needs to be focused on, how do we contextualize data. So both for contextualization and data quality, we follow the WHO frameworks. For data quality, it is the DQR framework, which is data quality review framework, which is being used at HISP. And then for data contextualization, it is a data to action framework that has been used. So you do have a lot of data exercises also within the program. We talk about capacity building as one of the session, whether you need to focus on capacity building or whether you want to focus on capacity strengthening. why strengthening is important or why it is the future of public health training. And then, of course, we have concepts like integration, interoperability. What is the difference between the two? So these are certain topics that we cover within the program. Anyone who is interested in learning about public health informatics and applying these concepts at their workplace are welcome to take up this program. So people can be from the health background, they can be from academic or training institutions, graduate students from the from stream of informatics, public health, hospital management, healthcare management, and even from life sciences. They can come and they can enroll in this program. So why to enroll is, like I said, globally it is recognized. The whole program is designed in collaboration with Hispindia and University of Oslo, and Hispindia has a lot of global case studies in the context of LMIC that we have worked on so far. Flexible delivery is there for the program. It's a self-paced program if you take it up online completely, with some sessions we would be taking up as live. So live will be where we will be walking you through the sessions, and then helping you understand the concepts. So it helps you to bridge the skill gaps, and also it helps us to be interactive with the audience that is enrolled in our program. So these are some of the testimonials that we have received. So we had this program, we have run it with one of the NGOs here in India, Piramal Foundation. So they have a vertical which is Digital Bharat Collaborative, and they focus on a lot of digital health initiatives. So Dr. Mithun James, who works as a solution architect at Piramal, he has given his testimonial. And then we also had this program run at at one of the universities in Bangalore, which is RV University. So first batch has been done. We are also in the process of starting the second batch for this university. We are also running this program as a pilot in International Institute of Health Management and Research, New Delhi, which is IHMR Delhi. And various other academic institutions where we are running this program as pilots. So yeah, these are some of the testimonials. We also have a participant from the program currently. I don't know whether the person is still here. I think Lutfullah, he left. So he is also currently pursuing this particular program. So that's it from our side. As we have mentioned, public health, we all know it is evolving. Every now and then we have emerging health issues coming up, which are very complex in nature, and hence it is the need of the hour that we also need to upskill ourselves and keep our tools and mindset open, so that we can learn to address these complex issues that are arising in LMICs and across the globe, right? So systems thinking will always help us in tackling the root causes, not just the symptoms. It helps us to design scalable and sustainable solutions which can be applied with given the local context. This is very, very important, that we at times we forget about the local context, but systems thinking helps you to incorporate the local context also, and then design interventions which are both scalable and sustainable. So let us all come together and build a future ready workforce which helps us in addressing these complex public health challenges. So that's it from our side, and thank you so much for attending the webinar and participating in the webinar. Any questions if you have? Now the room is open for discussions and questions. Anyone would like to discuss? Carol, Difana, Dr. Anupama, Enoch? No?
Okay, so thank you very much for this insightful section. And I'm really happy that for this session I've learned a thing or two with systems thinking. So now I know how to approach a problem or a bottleneck when I want to tackle it, how I should go to get the root cause of it and not merely just the surface of it. Thank you very much.
Thank you. Thank you so much, Mr. Enoch. It was pleasure talking to you, and thank you so much for joining the webinar. I would like you, if it's possible, can you please switch on your cameras? We'll just take a snapshot, if it's possible. Just 2 minutes, everyone. Difana, Dr. Anupama, Sahil, Preksha, Carol. Okay, I'll just take the snapshot like this. Okay. Thank you so much. Thank you for joining, and we see you soon. There'll be a lot of other, we'll be coming up with other webinars and publications. I would request you all to please join our WhatsApp group so that you remain updated, so that you're updated on the latest happenings that we have at HISP India. Yeah. Thank you so much. Bye-bye.